Bed making. First is closed bed. The closed bed. This bed is made after service personnel have cleaned the unit following a patient's discharge. The purpose. The bed is made up closed so it will stay clean until a new patient is assigned to it. Materials and equipments. Bottom sheet, plastic draw sheet or disposable bed protector, cotton draw, top sheet, blanket, bedspread, pillowcase, pillow protector if used in the institution. Wash hands. Helps to control nosocomial infection. Place a chair near the bed. Put the pillow on the chair. Stack the bed-making lining items on the chair in the order that you will use them first. Things to be used on the top and last things to be used at the bottom. Documentation, evaluate correctness of the procedure rendered to ensure that it is done correctly and in accordance with the procedure. Evaluate other needs of the patient to guarantee that they have what they need and what they are comfortable. Documentation, document any unusual circumstances observed such as blood stain, discharge on the sheet. Always keep an eye on the patient, especially the liquid drainage, such as blood stain, to assist, report immediately, and provide the best care for the patient. Open bed. When a patient is assigned to a unit, the closed bed is made into an open bed by fan folding the top sheets down to the foot of the bed. Purpose: the bed is made when a new patient is already assigned to it. Evaluation. Evaluate correctness of the procedure rendered. After you've finished, always double-check the bed sheet to make sure it's done correctly to provide comfort. Evaluate other needs of the patient. Inquire about the patient's needs in order for him or her to feel at ease. Documentation. Document any unusual circumstances observed such as blood stain, discharge on the sheet. Always keep an eye on the patient, especially the liquid drainage, such as blood stain, to assist, report immediately, and provide response. Post-operative bed. The post-operative bed is also known as the operating room bed, anesthetic bed, recovery bed, or stretcher bed. The post-operative bed is a bed made for patients returning from the recovery room. Purpose: to allow easy transfer of the patient from the stretcher to the bed with bath blanket. This bed is made to keep patient warm. Materials and equipments: mattress cover, bottom sheet, plastic draw sheet, cotton draw sheet, top sheet, blanket, pillow, pillowcase, bedspread, 2 cotton bath blankets. Follow the policy of your healthcare institution with regard to using bath blankets, plastic laundry bag, and pillow protector if used in your institution. addition, evaluate the correctness of the procedure to ensure the patient's safety and comfort. Ask patient's comfort to determine the patient's level of comfort. Documentation, record that you've made post-operative bed to keep track of and record what needs to be done next. Record the additional linens used to evaluate the materials that have been used. Record any unusualities observed to avoid any discomfort or accident such as blood drainage and to evaluate patient safety. Occupied bed. The occupied bed is made with the patient in the bed. Purpose: to ensure that the patient remains to be in bed when the patient is with a CPR or complete bed rest, or patient is completely bedridden. Wash hands. Washing hands to avoid pathogen and cross-contamination in linens. observation, evaluate the correctness of the procedure done. Always double check the bed sheet after you've finished to ensure it's done correctly, and evaluate how the patient tolerated the procedure to determine whether the patient is comfortable or not with the bed that has been designed. Check any unusual observations to report to unusual observation and avoid the possible bad outcomes. Documentation. Record that you have made the occupied bed and how the patient tolerated the procedure. To explain to the patient how the procedure is performed and what items should be added to make the patient more comfortable. Your observations of anything unusual. Before leaving, ensure the patient's safety. Turning and positioning a client on bed. It is the technique in repositioning a client on bed. Purpose: it aims to prevent complications that may arise while client is confined in bed, positions client for comfort and body alignment, and positions client for a variety of clinical procedures. Equipments: pillows, rolled blanket or towels, footboard, and hospital bed. Documentation. Evaluate client's tolerance and response to the procedure. Evaluate the client's position for alignment. Always check the vital signs before and after the procedure. Evaluate any abnormal findings on skin assessment to ensure that the patient is doing good and determine if any physical or mental problem occur before and after the procedure. Documentation. Record the client's position. Record any complaints of pain, dyspnea, and discomfort observed during repositioning. Record the client's response after the procedure to identify if any physical problem or other pain is felt and ensure that the patient get the right care at the right time to provide clear and precise account of the clients. Transferring technique. It is the use of proper body mechanics in repositioning, lifting, and transferring of patients safely. Position and prepares the client for a variety of clinical procedures. The movement maintains and restores muscle tone. Equipments, bed, wheelchair or chair, stretcher, pillows, and safety belt. Wash hands to prevent cross-contamination. Identify the client, inform client about desired purpose and destinations. Allow client to cooperate accordingly. Place one arm under the client's legs and one arm under the client's back. Slowly pivot the client and put client in sitting position. Bring the chair or wheelchair close to the side of the bed. Place it at 45-degree angle of the bed. Evaluation. Evaluate client's response and tolerance of the procedure. Always check the vital signs before and after the procedure. Documentation. Record the procedure. Maintaining an accurate record of your clients will allow you to determine your client basis specific demographics. Record any report of pain, dyspnea, and discomfort observed during the transfer to identify any physical problem or any pain. Record client's tolerance to the procedure to provide clear and precise account of the client's health care. Wash hands to prevent cross-contamination. Documentation, evaluate client's response and tolerance to the procedure, evaluate client's body alignment onto the stretcher to ensure that the patient is doing good and determine if any physical or mental problem occur. Documentation, record the procedure, record any report of pain, dyspnea, and discomfort observed during lifting, and record client tolerance to the procedure to identify any physical problem or any pain and to provide clear and precise account of the clients.